Mari McInerney from Croaky, and we're at the Aboriginal and Torres Strait Islander Suicide Prevention Conference in Perth. And I'm speaking here with Jody Kopp from the Mental Health Association of Central Australia. You just presented, Jody. Thanks very much for doing an interview. Could you first describe your role in the organisation, and then let's talk about Suicide Story, the project you talked about?
So my role within the Suicide Story program is I'm the chair of the Suicide Story Aboriginal Advisory Group, but I'm also a facilitator within that program. Suicide Story is a suicide prevention program for Aboriginal people. We travel throughout the Northern Territory delivering our 3-day program. And what happens with Suicide Story is we have all Indigenous facilitators. We have staff within the Mental Health Association of Central Australia that does all of our logistics and everything that needs to be done when we go remote to deliver programs. And we go into communities and we talk about and help them, and they help us also, with tools around, culturally safe ways of dealing with suicide, but also we know when we go into communities that most communities have the answers to the issues that are at hand in those communities. We know that our communities are very smart. We know that they have bright, up-and-coming young people that also know, what needs to be done on community. And what we do is we come in with a few tools and we help and we assist in whatever way we can in the 3 days that the program runs there. We also have community action plans that at the end of our program we talk about how, in an ideal world, that they would like for their community to be. So they will talk about a wish list. The wish list can consist of anything from we want a men's safe house, or we want a childcare, or we want the clinic and the police to work more closely with our people. Basically, services within communities working together for the betterment of the people of those communities. So that's basically what the wish lists and the action plans are normally around when we go into communities. So when we travel, we don't just deliver a workshop and leave and open this huge can of worms and take them back to that, post-traumatic stress time. We visit communities that we deliver in 4 times in the 1 year. So in the past 12 months, Suicide Story have touched the lives of between 500 to 600 people in the programs that we've delivered territory-wide and in South Australia.
And what happens with going back each time? What can you build on?
What we can build on is we look to gauge from the community action plans if anything has been successful, if they've been able to, network more closely with the police or the clinic, if they have sought funding enabling them to be able to get a men's safe house. So we just follow up and assist in whatever way, whether it be like needing help in where they can seek funding, helping with writing submissions, and just checking on the community that what they've talked about and what we've talked about as a collective in that community, that they're moving forward towards that, not staying stagnant.
And was this developed within your organisation? How did you come to do it?
So Suicide Story was developed by a group of people from the Central Eastern Aranda lands of Alice Springs, Aranda country, and also the Barkly region people. So they came together and knew that there was a need because people were dying and people that we loved were dying. So they talked about what it is that we could do to help our people. So from there, the Suicide Story slowly developed from different concepts, like the fire being our spirit. So when we talk about our spirit, we talk about our fire. If our fire's low, our spirit's low. If our fire's high, enabling us to be able to light other people's fire, we know that our spirit is strong. So we talked about all different concepts and methodologies that were easy for our people to relate to. We do a lot of oral and we do a lot of visual stuff in the workshop, not a lot of writing and not a lot of stuff that our people Like when it comes to education, our people, they prefer our ways of learning, which is oral and visual, so we do Suicide Story in that way so that they're comfortable. But over the 10 years that we've evolved, we've also listened to the feedback of all of our participants, asking us and telling us, best ways to deliver and best ways that they can understand, so that we've also grown with their support and their help. But yeah.
And I know it's a difficult question, but how do you evaluate your success?
We evaluate our success with when people that have come through our program and they see us and they've saved someone's life and they come and say, Jody, the other day someone nearly passed, but this is what happened, and thank you. It's as simple as that. And I think the other thing is too, like when you go back to communities and they're healthier and they're happier and you've helped in that process, that's how we evaluate our work.